Hi, my name is Dr. Robert Kaufmann. We're about to go beyond the terminus. Okay, you've just finished an endo treatment or retreatment, and you're about to dismiss the patient. What kind of post-op instructions are you giving them? Post-op instructions are an important part of endodontic treatment. Many symptomatic patients are sent to me by referring dentists without giving the patient much information. They may diagnose a pulpal problem, but really just want to relieve the patient's symptoms. The patient may not have been given a comprehensive treatment plan or even an understanding of why they required endodontics in the first place. There are two main reasons for the loss of endodontically treated teeth. First is that the tooth was inadequately restored after endodontics was complete. It's imperative that we explain to patients that they are responsible for proper restoration of the tooth to prevent subgingival cusp fractures or catastrophic split tooth. Endodontic treatment is only part of the entire rehabilitation process, and it must be made clear to the patient that prior to the initiation of treatment, they are responsible for this. Unfortunately, insurance benefit maximums are often the biggest influences on patient decisions and whether they want to keep the tooth or not. Endodontic treatment alone can often exhaust patients' benefit maximums, leaving them no remaining benefits to have the tooth restored. The lack of any benefits frequently delays the time frame of the patient's restoration. In that case, it becomes imperative that the tooth is either temporized adequately at the time of endo treatment with something like a copper band or a core restoration that's cusp protected and relieved to prevent the tooth from fracturing. Even then, leaving a tooth in temporaries for months at a time without final restoration risks possible loss of coronal tooth structure, canal recontamination, or outright split tooth. The second is that part of my job as an endodontist is not just to perform endodontic treatment on my patients. It's to educate them as well. Patients presenting with pulpitis need to know why this occurred. In the case of an endodontically treated tooth, the reason they initially sought treatment may have been thermally related due to deep caries or restoration, trauma, fracture, or other pulpy-related problems. Was it due to inadequate oral hygiene, infrequent checkups, cracks caused by bruxism, or an unfortunate event with a piece of candy or popcorn? Understanding why this occurred allows the patient to take steps to ensure that this doesn't happen again. Should the patient require an endodontic treatment, we take extra time to educate the patient about the procedure, why it's necessary, and how the tooth is affected by the treatment. That involves a detailed explanation of tooth anatomy, canal anatomy, and the effects of removing the pulp from the tooth. Most patients have the misconception that once root canal procedure is performed, they don't have to worry about the tooth anymore, especially if it's full cuspal coverage restored. I estimate that roughly 80% of my patients do not understand that teeth can become carious after endodontic treatment, even after they've been restored with a crown. I use the following analogy with all of my patients before they leave the office. I tell them that the pulpal symptoms that prompted them to be referred to me were like a fire alarm. The alarm protects the house against damage. It turns on in the case of a fire, or is off when there isn't one. There's no middle position. It's either on or off, a binary system. Disconnection of the fire alarm does not prevent the house from burning down. It merely disconnects the system that senses the danger. Endodontic treatment turns this alarm off. It doesn't protect the tooth against damage. Removal of the pulp means that they'll no longer have any symptoms to caries, hot, cold, sweets, or fractures. When caries gets to the point where the patient notices it's a problem, it's frequently too late to salvage the previously endo-treated tooth. The restoration becomes loose due to caries or debonding, or they have a bad taste in their mouth originating from underneath that washed-out restoration. The result could be recontamination of the canal system, contributing to endodontic failure. We do this not only to educate the patient about the potential caries, but also to emphasize to them that adequate coronal seal is critical for long-term success of my treatment and protection of their investment. It's very frustrating to perform multiple endodontic procedures on a patient, only to find out that a few years later on recall, the tooth I treated was extracted because of persistent poor oral hygiene, associated decay, or that it was never properly restored in the first place. In some cases, because the patient is symptomatic in another area, we may now be considering treatment of another tooth. Unless we address the reasons for the loss of that initial tooth, why would we believe that treating a new tooth would provide any different result? Well, it's not the job of the endodontist to treatment plan this patient. It begs the question, why are we doing treatment on patients who do not appreciate the need for proper restoration, better hygiene, consistent checkups, and the efforts that are being made to try to save their teeth? In that case, it may have been better to extract the tooth or provide some other prosthetic solution for the patient that leaves the patient less frustrated and more confident that their investment will last long term. These are the kinds of discussions that must be had prior to referral in order to ensure that patients' expectations are met and that the procedures performed will result in long-term solutions rather than interim temporary fix. Patients who understand treatment, who understand post-op treatment requirements for restoration and maintenance, and who appreciate the efforts involved in saving their tooth are much more likely to keep the tooth in the long run. Those discussions are part of the informed consent that we must obtain prior to initiating treatment. Remember, when we do the right thing, we both get better. Clinicians and patients, thanks for watching. Don't forget to subscribe and like. I look forward to our next trip when we go beyond the terminus. See you then.